Hi, everyone. Welcome to Conversations with Catherine. I am very happy to have with me my guest, Dr. Michael McQueen. He is the CEO of Good Night Pediatrics, an all-night urgent care for kids in Phoenix and actually across Arizona in some cases. It's very nice to see you, doctor.
Catherine, thank you so much for having me on your show. I appreciate being here.
Well, thank you, and congratulations on 15 years of serving children and families here in Arizona. That's pretty exciting.
Thank you for noticing and saying something. It's exciting for us too. We opened our first Goodnight Peds location, which is still open, in November of 2004. So it's been that many years, and in that time, we have kept over 750,000 kids out of the emergency room.
Yes, indeed. And still going strong despite the pandemic, which is what we really want to focus on, the fact that you are still seeing children and families as you have been for so many years, but with a little bit of a pivot. So let's start by talking about what Goodnight Pediatrics is all about for those who are not familiar with it. How does it differ from emergency treatment center or ER?
Great question. It is truly an urgent care, so it's not emergent care. If you're and the niche that we fit, Catherine, is twofold. One, we're just for kids, and two, we're just at night. Our clinic opens at 5 p.m. at night and stays open until 1 in the morning, and it's just for kids. We see newborns through age 18. And so if your child truly has an emergency situation, you do need to go to the ER. But as we all know now is actually the worst time ever to go to the ER. So we are an after hours alternative if your pediatrician's office is closed and your child needs care after hours for cough or fever or sore throat or asthma or kind of routine things you might walk into your doctor's office with. We're there for you with pediatricians on site.
And because of the overcrowding situation we are experiencing right now with the pandemic, you have been able to pivot to telehealth that you're offering now. Telehealth is very popular, as we've seen. What kind of a difference has that made for the children that you're able to continue serving?
I think it's made a huge difference. We're certainly not the only medical practice that has started to utilize telehealth. If COVID has a silver lining, perhaps it's been driving that innovative technology. So we have one location in the West Valley where patients can still walk in with their child, or if you're anywhere in the state of Arizona, you can go to our website and follow the links for a telehealth visit, and you'll see one of our pediatricians face-to-face just by using your iPhone.
And this is so convenient, as you mentioned. Now you're able to see kids and families across Arizona. The telehealth, does it have the same hours as Goodnight Pediatrics in person?
Yes, thank you for clarifying that. It does. We start that service at 5 p.m. And go through 1 in the morning. And it has been really a blessing. We've kind of learned how to do it on the fly. I will say that when we started doing it, it was new for all of us. We've now seen somewhere between 50 and 75 telehealth visits just in the last 2 months.
Wow.
And so our doctors are really getting the hang of it. Our staff is really getting the hang of it. Not everything, of course, can be done over the iPhone. If your child has asthma, for example, and needs a breathing treatment, we'll have to tell you, sorry, come in or go to your closest location where you can get a breathing treatment to do that. But in terms of evaluating the child, taking a good history, getting a good look at them, and in most cases, solving your problem, we're able to do that over the phone, over the iPhone.
Well, and you have access now, these families and children, to physicians 7 days a week, even on holidays, through your telehealth that you're offering. Tell me a little bit about your full-time physicians and how they're able to serve the children and families, because they are pediatricians, which is important to note, right?
I think that's another, thank you again for mentioning that. It's another important differentiator between us and the emergency room. Certainly there are emergency rooms that do wonderful jobs with children. I'm not saying that there aren't. There are also emergency rooms that are frankly designed to handle more of the adult population. And so if you have to go to the ED, you don't really know if you're going to see a provider that's comfortable seeing your child or not. We decided early on to stick with our niche. We are only for kids, and so we staff only with pediatricians. We have 2 full-time pediatricians working with us now, Dr. Jackson and Dr. Fakuri, both of them with over 20 years experience. Both of them are the kind of pediatricians that you'd want your kids to see. They are kind-hearted, they are knowledgeable, they are personable, and they just do a fantastic job for us.
And one thing that's really important to note, I think, as well, is that if there is a situation, whatever that situation is, that needs to be followed up with a child's regular pediatrician, they are given notes from that visit, correct?
Yes, that's actually a given. That's part of our service. One of the things that we do, I think, very well is after the child is seen at Goodnight Pediatrics, and again, whether that's in person or via a telehealth visit, the doctor will generate the note for the patient chart, just like always, and that note will go to whoever the child's primary care physician is, pediatrician or family practice doc or whatever. And usually within 24 to 48 hours, they'll have that note. If there's follow-up required, we want the child to see the primary care physician for the follow-up. So we're trying to really be an extension of their medical home just in the nighttime hours.
That's so important because you don't always get that experience when you do visit an ER. So walk me through the telehealth process then, because as you mentioned, you can do this on your phone, you can do this on your regular computer. So if I wanted to go ahead and create an appointment for that, what is the process involved?
Great. It's relatively simple. You go simply to our website, www.goodnightpeds, P-E-D-S as in pediatrics, goodnightpeds.com. Prominent on the website when you arrive there will be, we offer telehealth visits, and it will say, go to online registration. You click that link, there's a form to fill in your information, your child's name, your insurance information. We take all insurances, by the way. And the reason you want to be seen. And then that puts you in the queue. When the doctor's ready to see your child, you'll get a notice on your phone that it's your turn to be seen.
It's a very simple process, but makes such a difference. You still have, as you mentioned, the one location that is open for people to go in person. Tell me a little bit about what you're seeing with that one location, because as I understand it, you have families that come from all over Arizona, right?
We do. Certainly, I would, for the on-site visits, I would certainly say all across the valley. The West Valley location was our flagship location. It was the first Goodnight Peds clinic that we opened. At the end of 2019, I will tell you, we had 5 locations open. We had 4 in the valley and 1 in Henderson, Nevada, a suburb of Las Vegas. Because of COVID, because of the pandemic, we've had to close 4 of the 5 clinics. And so the one that's left open is the Avondale location in the West Valley. It's right off the 101 and I-10s. It's at 103rd and McDowell. So it's very easy to get to. And because of that, we have people coming from Glendale and Peoria. We have people coming from the East Valley. We have people coming from Scottsdale. By the time you would go to an ED and wait and have your child seen, plus it's the ED environment, it's actually probably quicker to drive and go to our location. The wait times have been anywhere from 15 to 30 minutes. That can vary depending on the crowd. It can get longer if it's a busy night, but that's been typical. And you can be back home after being seen. Or again, you can not leave the comfort of your home and do the telehealth visit if you prefer. But we have seen folks from all over the valley coming on site, just if they prefer.
And if they do prefer to go and visit on site, what kind of social distancing and PPE procedures do you have in place?
Yeah, we follow every CDC regulation. Masks are required to come into the clinic, 6 feet of social distancing. What we'll do is have you come in. If you can register online, again, just check out the website. You can kind of pre-register online and have your place reserved, so to speak, for when you get there. Or you can just come in and fill out your paperwork there. We'll probably send you back to your car to fill out the paperwork and wait. You'll be safe, you'll be away from crowds, you'll be just isolated with your own family or your child, and then we'll ping you on your phone when it's your turn to come in and be seen.
It's so convenient, so simple. You're making it so easy.
We're trying, and I think, again, a lot of good practices have adapted to this pandemic by doing that, but we certainly want our families feeling safe when they come. Of course, all of our providers and our staff are wearing masks and following all the PPE precautions.
Very important. I wanted to just briefly touch on the fact that you mentioned you take all insurance. The copay for visiting Goodnight Pediatrics is always an urgent care copay, not an ER copay. And tell me why that's so important.
Well, it's important for 2 reasons. One, simply because of the financial impact. An urgent care copay is typically around $40. Look on the back of your insurance card and it will tell you. And an emergency room copay can be 5 times that. It can be $150 to $200. Again, check your card and see. So there's a big difference. Make sure you check if you're going to what you think is an urgent care. You might ask them and confirm before you go, is your copay an urgent care? Because there are some that are higher and closer to an ED or actually an emergency room copay. I can't speak to anybody else's business model. I can tell you that we're 100% always an urgent care copay. If you're an access patient, there is no copay, and we accept all access plans as well. So we're there for the kids. We're putting the patients first. We're trying to keep them out of the emergency room and trying to make that as safe and affordable as possible.
Well, I have talked to so many businesses in the last almost a year who have done such a remarkable job of pivoting, and getting creative in how they can still offer their businesses, and what their services are. And you've obviously done a great job with pivoting to telehealth. Is this a component you think Goodnight Pediatrics will stay with beyond the pandemic?
I think it is. I think it's simple enough, it's efficient enough, and it's frankly effective enough. I had concerns. I'm an old school doc, Catherine. I thought you had to put your stethoscope on the patient and lay hands on and do there, just because I'm an old dog and that's how I was trained. I've been really impressed. The younger docs especially, and the younger patients especially, are very comfortable over a telehealth visit. And again, if it requires an insight or an on-site evaluation, the doctor will tell you that and say, sorry, we can't do this over the televisit. You need to either come see us or go to the closest facility that's convenient for you. And they'll let you know that. Because it's so efficient and because we can access patients from all over the state, I absolutely plan on keeping it in place when this pandemic is over.
And I know you mentioned that some of the other locations had closed. Is that temporary? Do you expect to reopen them at some point?
We do think it's temporary, and we do expect to reopen. We had hopes, I think probably like a lot of businesses, that 2021 would see a more rapid return to normal. It looks like it's going to be, the first half of the year is going to be more of the same, and maybe even on to the second half of the year. So we'll have to just play that one by ear. We will keep Avondale open. We'll keep the telehealth open, and as the pandemic allows, we will look very strongly at opening our other locations again.
Well, you've done an amazing job for the last 15 years in helping children and families stay healthy, and you continue to do it via telehealth. So I want to remind people that they should go to your website and definitely learn more about that component. It's goodnightpeds.com. And there's also an option for folks to do that pre-arrival check-in there as well.
That's correct. Thank you.
Dr. McQueen, thank you so much. I also want to let people know that you are on Facebook, Goodnight Pediatrics Avondale, and also on Twitter at Goodnight for Kids. Always a pleasure to talk to you.
It's so good to see you. Thank you for your time and your courtesy as always.
Thank you. Good to see you too.
Thanks so much for watching Conversations with Catherine. Please remember to hit the subscribe button, like, and comment while you're here. I'll see you next time.